With the new school year approaching, with fall sports ramping up, it's always a good time to talk about overuse injuries. And specifically, I'd like to talk about the youth and adolescent population as we're kind of ramping back into these fall sports. There's a few conditions that we commonly see in the office. Hi, I'm Dr. Zach Ratliff of TruMotion Therapy in Charlotte, North Carolina. We specialize in the conservative management of musculoskeletal pain and injuries, meaning we treat pain and dysfunction without the use of drugs or surgical intervention. The three conditions I'd like to talk about today include knee pain, heel pain, and hip pain. Now, these are commonly seen in our youth and adolescent athletes because of the explosive, sprinting, plyometric nature of a lot of the sports that are played. Now, what these conditions are is tendonitis stacked on top of an open growth plate. Now, the broader term to describe these injuries would be called apophysitis. So that is an inflammation of a growth plate. But again, it's a tendon pulling on that growth plate. So we have a little bit of a complexity with overlapping growth plate inflammation and tendon inflammation. The conditions that we're talking about here are Osgood-Schlatter's, which many people are familiar with, similar to a patellar tendonitis. We have Sever's disease, which is a heel pain similar to an Achilles tendonitis or sometimes even a plantar fasciitis. And then we have iliac apophysitis, which is the front of the hip. So in our adult population, this might look like more of a hip flexor strain or tendonitis. Now, with our youth athletes, these injuries commonly occur when a growth spurt coincides with a sharp increase in activity. So take the start of a season where a lot of conditioning is being done for the sport, trying to get everybody kind of in shape for the season. And with our youth and adolescent athletes, they're constantly growing. When those two things intersect, it leads to a ton of muscle tension, and it puts a little bit more strain on the tendons, which then the tendon pulling on the growth plate, it just kind of doubles down on this inflammatory process. Now, these conditions do tend to be self-limiting. They will eventually kind of work their way out as that growth plate closes into adulthood. But in the short term, there is a lot from the conservative medicine side that can be done to expedite this process or mediate some of the pain that is felt along the way with these conditions. Now, if you are a coach or a parent to an athlete with any of these conditions, I would invite you to check out our website at TruMotionTherapy.com, where we have more information as well as the ability to schedule an appointment with one of our providers. These are conditions that we commonly see in the office and have helped a ton of athletes kind of get prepared for their season and stay healthy throughout the season. So I'd invite you to check out those resources, and we would love to help your youth athlete navigate a strong season and have some great results.